This is the territory we don't want to be. We don't want to reach this stage. We don't want signs and symptoms of rabies in the pets or human beings. But for academic exercise, let's go through the signs and symptoms of rabies. The reason why I have said that we don't want to reach this stage is once we start picking signs and symptoms either in animals or human beings, that is the end of that animal or human being because there is no treatment, no cure. Now, signs and symptoms. Incubation period. Usually 5 days to almost 2 years. But the common time that incubation period will last is 1 to 3 months. The prodrome time is around 0 to 10 days. Acute neurological period 1 day to 7 days. Then coma in 5 to 14 days and death. The differences between incubation period, the prodrome time, the onset of prodrome time to acute neurological period, and coma and the rest will be explained further. The incubation period is not fixed. And that is because we have so many factors that could determine the incubation period from 5 days to 2 years. The first I'm going to consider is the size of the bite or scratch. If this occurs at the head and neck region, it's going to be faster. Also the viral load, the variant, and then the concentration of the inoculum. If it is higher, the incubation period will be shorter. The host immunity is another strong factor. Depends on the immunity of the bitten animal or the human being that has been bitten. The presence of rabies virus neutralizing antibody IgG will confer some level of immunity. When we have that, the immunity of the host will be stronger than the person without it. Therefore, the incubation period will be longer. Certain cytokines, presence in the host immune system will also delay the onset of signs and symptoms, making the incubation period to be longer. For example, the presence of interferon, it's a form of cytokine, right? Will confer another immunity on the host. So the disease won't be able to become established. Previous vaccination will also disrupt the disease course. So all these will alter the incubation period. That is why we cannot find a fixed time to say the incubation period will be 5 days, 5 weeks, 5 months. No. Could be 5 days and it could be 2 years based on these factors. But commonly, the incubation period will be between 1 month to 3 months. Prodrome. After the incubation period are passed, which will be 5 days to 2 years, mostly 1 month to 3 months, the virus will enter the peripheral nervous system either directly or by dividing the muscle or tissue where the virus had been deposited or inoculated. The virus will likely remain here for the entire period of the incubation, either 5 days or 2 years. When you carry out an investigation that time, you are not going to get any positive result. Even the virus may be there. Later on, the virus will then move centripetally to the peripheral nervous system. Their division will continue. Then signs and symptoms will start. And that will be the initial signs and symptoms. That is prodromal phase. The signs and symptoms here will start at the wound site, tingling, itching, burning, pain, or numbness. Then we'll be battling with flu-like symptoms, nausea, vomiting, diarrhea. Some will have cough, fever, fatigue, muscle pain, sore throat. At this stage, it is still non-specific. So the trouble has started, and some will start guessing what is actually going on, but may not guess that it is rabies yet. We are moving away from the prodromal phase that will be about 10 days to the neurological period that will take about 1 to 7 days. Okay, so at this time, we can be dealing with what is known as furious rabies or paralytic rabies. The furious rabies will be a kind of aggressive phase. Furious, now the English word, right? Here we can have restlessness, tachycardia, seizures, inability to sleep, insomnia, fasciculation, breathing fast, tachypnea, hyperactivity, anxiety, confusion, agitation, delirium. Then I will address some other things that are specific to rabies at this point. Hydrophobia. Hydrophobia here is that there will be spasm along the throat. So with that, mere thinking of swallowing or drinking water can even trigger that spasm. So the spasm and the associated pain would discourage the affected person from wanting to drink. So they can't drink easily, and they don't. Once they see the water, they'll be running away from it. It's not that they are scared of the water, but the fact that swallowing will become difficult. That is why they have hydrophobia. Aerophobia will also occur. That is, they will be afraid to face fresh air, okay? And they can run into lack of coordination. On top of this, they can develop hallucination. So the delirium and everything that will come with furious rabies or aggressive phase will be back and forth, meaning the furious rabies can have the time that it will abate, it will calm down, okay? If we are dealing with that, we call that episodic furious or furious episodes, and there will be calm in between the episodes. But what we're going to find when the episode comes back are those things I've listed earlier. Then we move to another part of it, which is the paralytic rabies. In this case, it's just about 20% of the presentation under neurological problems associated with rabies. Here there can be fever, neck stiffness that we can misdiagnose as meningitis, and there may be headache and paralysis. The Paralytic rabies will take longer course. Unlike the furious that is going to come, in form of episodic attacks, will come, everything rush, 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 aggression, hallucination, seizures, everything will come fast, fast, fast. Then it will calm down and come back. In the case of paralytic, it will just continue like that, getting worse with time, right? It takes longer course, and just about 20% of cases. The muscle will become paralyzed gradually. The muscles that will first become paralyzed will be those ones around the site of bite, okay? And then will progress to generalized weakness of the entire body. In both cases, we can run into coma after. Coma will develop after, but it's going to be a gradual process and we'll get into coma. The coma will likely occur after 5 to 14 days. So we'll get into that, troublesome juncture. Now, this is what we don't want, and that is why I'm making this presentation. Either prodromal phase progressing to furious or paralytic rabies will get to coma. From coma, that will be getting worse and worse, then there'll be respiratory failure, there'll be cardiac failure, respiratory arrest, cardiac arrest, known as cardiorespiratory arrest. In that case, that is the end of the road. Death. Death. Once the signs and symptoms are here, no more intervention. It's going to end up in death. Cardiorespiratory arrest. I'm not a specialist in animal issues, but for the purpose of this presentation, I will delve into this just once. This is not for people who had vaccinated their pets. You could say cats and dogs, right? But for those who have not, maybe you don't have the rules and regulations in your country to do. So watch out for this. Okay, in animals that have been bitten by other rabid dogs or other rabid animals from the wild, the prodromal and neurological stages will occur just as we found in human beings. But specifically, you can get the following when you observe your animals very well. There will be behavioral changes. Your pet, your dog, your cat has been known to be friendly. Suddenly will become aggressive. Or the pet has been known to be the slow walking, quiet type, suddenly becomes hyperactive. Or the other way around also. There will be hypersensitivity to light, to sound, to touch, and to movement. And because of that, they will be seeking quiet and dark places because they become hypersensitive to light. That is why they go for dark places, and hypersensitive to sound, then they'll be going for quiet places. Okay? Then there's an entity known as madness. This is what many people will see, and they will know that their dog or cat is now carrying rabies virus. And that is, the pet will attack just anything. Just anything. That's why people say mad dog. Just anything. Living and non-living. Running around. Barking and barking and attacking. Anything. That is the madness. Lastly, the bad news. You love your pet, but once we reach this stage, foaming in the mouth because of increase salivation. Remember, I have said earlier, during pathogenesis and multiplication, that the virus will reach the salivary glands. And it is from the saliva licking or biting and everything that they will transfer it to another animal or human beings. So, for me, at that point, I'm sorry, your pet must go. No, the animal must die. Then we will use the brain to test for rabies.